Hello everyone, welcome to the OSCE series, case 13. So today we'll be discussing a very interesting case. So here we have a 30-year-old male who presents with weak abdominal pain, and these are the post-contrast CT scan sections of this patient. Based on this, what do you think the diagnosis is? This is the arterial phase, this is the portal venous phase, and these are the delayed images where we can see this splenic lesion. The arterial phase is peripheral enhancement that is seen. On the portal venous phase, the enhancement actually increases centripetally, and on the delayed phase we can see that the lesion is almost isodense to the rest of the splenic parenchyma. Some areas of hypodensity that is seen, that is non-enhancing area, central non-enhancing area that is seen. So what do you think the diagnosis is based on these images? These are the MRI images which are seen here, where again these are the T2 weighted images and these are the T1 weighted images. On T2 weighted images, we can see that this lesion is T2 hypointense. It's an important imaging characteristic. The diagnosis should be very clear based on this T2 hypointensity. And these are the T1 post contrast images where we can see that this lesion is enhancing along with some central scar which is non-enhancing. So this is MRI is showing it better, that central scar, than CT scan. So this is a very important point, that the central scar is very well seen on MRI, non-enhancing scar, on this T1 post contrast images. So based on all these images, the diagnosis should be very clear. So it's a case of SANT, that is sclerosing angiomatoid nodular transformation. Sclerosing angiomatoid nodular transformation of the spleen is recently recognized, and it's a rare non-neoplastic vascular splenic lesion of uncertain origin. On CT, it usually presents as a solitary, well-circumscribed splenic mass with smooth lobular borders and is variable in size. On non-contrast CT, it is almost homogeneous to the surrounding splenic parenchyma, and on post-contrast phases, it demonstrates a comparatively hypovascular center and enhancing rim and radiating vascularized tissue penetrating from the periphery towards the center of the lesion. There was progressive central enhancement with delayed imaging uh, that is seen, giving a particular spoke wheel pattern. And on MRI, a typical T2 hypointense signal that is seen, which differentiates it from most of the splenic lesions. And other than that, that spoke wheel pattern is better visualized on T1 post contrast MRI. That is the central hypoenhancing stellate scar. That is also one of the characteristics for SANT. So coming to our next case, so here we have a 35-year-old male with Crohn's disease who came with complaints of upper abdominal pain. So what do you think based on these images the diagnosis is? So here are the features of Crohn's, that is comb sign and bowel wall thickening. Along with that, these are some splenic lesions that are seen, multiple splenic lesions, heterogeneously enhancing splenic lesions that are seen. So on the setting of this Crohn's disease with multiple heterogeneously enhancing splenic lesions, what do you think the diagnosis is? So it's actually a case of littoral cell angioma of the spleen, which is actually a benign primary vascular tumor of the spleen. And it has been diagnosed in association with various malignancies outside the spleen and also with Crohn's disease. So littoral cell tumors arise from the littoral cells lining the sinusoids of the splenic red pulp. And littoral cell angioma is actually a benign type as opposed to less common low-grade malignant littoral cell hemangioendothelioma. And on CT, there's multiple nodules or masses which are hypoattenuating compared to the normal spleen, and they demonstrate progressive homogeneous contrast enhancement later than the normal splenic parenchyma. So these are the features of littoral cell angioma of the spleen. So this finishes our two important lesions of the spleen that are commonly asked in spotters and OSCEs.